The concept of reduction of harm pillar is to provide a range of pragmatic and evidence-based public health policies designed to reduce harmful consequences associated with substance abuse and to foster recovery and hope for the user. Our last set of presenters tonight will be talking to us about how we can reduce the harm of addiction to the addict and their families, and their families will be. Scott Stokes is the Director of Prevention Services at the AIDS Resource Center of Wisconsin in the Green Bay office, and he'll be talking about his experiences and what the center is doing to help those with substance abuse issues.
First and foremost, I do want to let you know that there is hope for the person that is using. I am a person in long-term recovery myself from a heroin addiction. Last Friday celebrated 30 years of sobriety. And I do know of hundreds, if not thousands, of other individuals just like me who have found some success. The goal of harm reduction is to keep these folks alive until they are willing to get into treatment and make some changes in their life. The way we do that at the AIDS Resource Center of Wisconsin, we have a couple of programs. One is a clean needle exchange program. Each and every week we are seeing new exchangers come through the door. Our average age of the injector when we started in '94 was about 30 to 35 years old, and now we have a revolving door of 18, 19, 20-year-olds. We have a huge problem. We want to keep them free from HIV. We want to keep them free from hepatitis C. We know that if somebody makes it into treatment and they don't have either one of those diseases, their treatment outcomes are going to be much better than if they were infected with HIV or hepatitis C. A lot of times that could be a trigger for somebody to go back out and start using again because they figure that they're already doomed. Another thing we do is we provide access to drug treatment. In our Green Bay office, we made 146 referrals for drug treatment last year, and we're up to about 115 so far this year. Whenever we have an opportunity to talk about recovery options for someone that comes through our door, our staff jump on that opportunity. Most of the staff that work within a needle exchange program are people in recovery themselves. A lot of times needle exchanges might get kind of bashed a little bit as enabling drug users and just kind of promoting drug use. It really is our goal to get folks into treatment services. When we get that opportunity, we pull out all the stops and do whatever we can to get them in. So it was in 2005 when we launched our opiate overdose prevention program. And what that program consists of, it teaches drug users how to call 911 safely. And what I mean by that is they call and they say, my friend is down, and they're not responsive. They really don't mention the word overdose on the 911 call. They're all fearful of being arrested, whether that happens or not. They think it's real. So we teach them to say they're just not responsive, send help. And a lot of times paramedics show up and it's not that big of an issue. But in the meantime, we teach them how to lay them in a recovery position, clear their airway to make sure that they don't have anything lodged in their throat, and then also lay them in a position to provide rescue breathing. They have to keep breathing for the individual when they're in an overdose. It's a respiratory issue. A lot of times, it's not about chest compressions and keeping the heart going. It's about keeping them breathing in oxygen to the brain. So we teach them how to do the rescue breathing, and then we also teach them how to prepare a shot of naloxone and administer it to the individuals. After that, we teach them, that you have to monitor them. You still have to breathe for them for a while. Sometimes it takes 3 to 5 minutes for the naloxone to kick in. Sometimes they might need another shot. And we walk them through all these processes. And then when they revive, it's really important that they stay with the individual, because the first thing that the person wants to do when they're taken out of an overdose, they want to use again, because they are in a euphoric state. They have no idea that they're dying when they were dying. But they were exactly where they wanted to be, and they get a little bit agitated because the naloxone puts them into immediate withdrawal. So a lot of times the first thing they want to do then is go ahead and use again. So it's really important that we talk to them and make them understand that they can't do that, hold out for 10, 20 minutes, the naloxone's going to start wearing off, you're going to get some of your high back, and you're not going to be as sick as you currently are. It's also important that they understand that you can't think that you've gotten through this crisis and now I'm going to leave them and I'm going to go home. Naloxone wears off in about 30 minutes. the opiate can be on board for several hours. So there's a good chance that they can fall back into an overdose situation and then nobody be there to respond. We know that 85% of overdoses are witnessed, so that's 85 times out of 100 somebody could be there to respond to an overdose. If you have a drug addict in your home, I'm from the thought that you really need to have naloxone in your medicine cabinet. It's a pretty harmless drug by itself. If a child was to get a hold of it and ingest it, it's not going to harm that child. A lot of times when a paramedic comes to a scene and somebody's unresponsive and they don't know why, they'll shoot them with naloxone just because they think it might be an overdose. So there really is no ill effects if you give somebody the naloxone that doesn't need it. If anybody here needs to get naloxone in your home, please sign up. All I need is a name and a phone number, and we will have some staff contact you, and we will get you trained as quickly as we can. I want to thank you for your time.